the crisis of law. There we go. In fiscal austerity, Oxford University Press. I'm Brian Sargent, Assistant Professor of Sociology and Public Policy here at UMass in the School of Public Policy and the Department of Sociology. And it is my pleasure, absolute pleasure, to moderate this discussion between the book's author, Armando Lara-Millán, Al Roberts, and Aaron Foote. We plan to be here for about an hour to 75 minutes. We will start with a summary of the book by Professor Lara-Millán. We will then move on to a structured discussion where Al and Aaron will ask Armando questions and they will engage in a critical dialogue about different aspects of the book. I will be collecting questions from the audience in the chat, and we'll offer some of these questions to the author and the discussants towards the end. We are recording this, as I'm sure you just heard the alert, and that will be shared. So look forward to hearing more about that via email and social media. Please keep your, in the audience that is, please keep your microphones muted throughout, and that will minimize distractions. Now, without further ado, please let me introduce the author and the moderators. So Armando Lara-Millán is Assistant Professor in the Department of Sociology at University of California, Berkeley. He earned his PhD in Sociology from Northwestern University in 2013. And prior to joining the Department of Sociology at Berkeley, he was a Robert Wood Johnson Foundation postdoctoral scholar in health policy research. Professor Lara-Millán is an ethnographer and historical sociologist and studies how powerful organizations shape the life fortunes of large numbers of people, examining the knowledge production such organizations undertake, how they generate truths and rationalize problems and distribute resources. He has undertaken studies in a wide range of contexts, including law, medicine, criminal justice, economic pricing, and urban poverty governance. Thank you for being here and for your time, Armando. Al Roberts is director and professor at the School of Public Policy here at UMass. He writes extensively on problems of governance, law, and public policy. His most recent book, Strategy, I think this is his most recent book. He writes books so often, I'm gonna make a guess. Strategies for Governing by Cornell University Press in 2020 was his most recent book. Is that true, Al? Okay. And he's also author of other books, including the award-winning Blacked Out, Government Secrecy in the Information Age, among many, many others. Aaron Foote is an urban sociologist and community activist from Flint, Michigan. His current focuses include the examination of social, political, and economic factors that led to the Flint water crisis, specifically detailing how state and suburban actors colonized water rights in Southeast Michigan, ultimately leading to the poisoning of tens of thousands of Black Flint residents. His research also sheds light on the lived experiences of the thousands of families who fought back and were directly impacted by this tragedy. His PhD is forthcoming from the UMass Amherst Sociology Department in September of this year. He'll be taking up a visiting assistant professor position at Trinity College in Hartford this fall. Welcome, and thanks for being here. So thank you, Armando, for being generous with your time. Thank you, Al and Aaron, for your willingness to join in the discussion. And I also want to thank the incredible Mo for helping to advertise this event and for handling so much of the background logistical things with such nuance and patience. And with that, I will turn it over to Armando. Please, again, keep your microphones on mute as we go forward, and let's have a good time. Armando, the floor is yours.
Thank you, Brian. Thank you for organizing this. I'm really excited about talking to everybody here. It's a new audience for me, and I'm just curious to see what comes of it. Brian, do I have the ability to share my screen?
Give me 1 second.
It looks like I do.
If you do, go for it. Give it a try. If you don't, then I'll make you a co-host and we can go from there.
Can you all see my PowerPoint there?
Yes.
Cool.
Yeah, you're good.
Great. Okay. I'm just gonna, just grateful for everyone being here. I was writing this book, finishing the end of this book during the pandemic, and a lot of the news during that time, especially this spring, was hitting me like deja vu. The killing of yet more brown and Black people across the country, the crisis of the unaccompanied minors at the border has returned under a third president, and of course the pandemic sweeping through our nation's jails and public hospitals. Much has been written about the human suffering that goes along with these events, civil rights organizations, journalists, and other advocacy groups meticulously document extensive patterns of neglect and abuse. The administrators of these problems, the public administrators, see them a bit differently. For them, they're about making sure the right people are placed into the right slots, that the violent are kept away from the less violent, or the sicker are treated before the less sick. If they can do this, then on average, there's going to be less suffering, so the thinking goes. Today, I want to encourage us to think less of these institutions, or explaining these institutions less as institutions of poverty governance, and more as public institutions fighting for resiliency. If we can do this, it's my belief that we can better explain some of this feeling of deja vu. The particular problem that my book takes on is the expansion of medicine in large urban jails and its restriction in large public hospitals during the past 30 years or so. What does it mean to say that medicine is expanding in jails but becoming more restricted in public hospitals? Consider the fieldwork I conducted for a year in a large urban jail and a public hospital. In the jail, the ubiquity of medicine as a form of knowledge and technology to understand inmates and run the jail smoothly. In the hospital, there was a ubiquity of criminal suspicion to understand patients and make tough choices about who should receive very scarce public hospital beds. In the jail, it was nurses, doctors, therapists, psychotropic drugs, sedatives, mental health evaluation forms that all spring into action whenever there's a routine disruption to the process of jailing. In the hospital, the ubiquity of criminal stigma was all around us. Not only were police, jailers, squad cars, and handcuffs a continuous presence there, so was the suspicion that the patients who overcrowded the ER were not very sick, but instead were out to abuse the hospital as a source of drugs. These findings make sense, as I'm sure you can imagine, given the broader trends in these kinds of institutions. Estimates have around 20% of those in jail now suffer from serious mental illness. And the restriction of medicine makes sense given well-known capacity declines. In 1983, there were about 1,600 public hospitals open. By 2003, fewer than 60% remain. You may have an explanation already in your mind. Indeed, whenever the topic of jails and hospitals is raised, some version of the following idea is repeated, that because we as a society have disinvested in public health, particularly mental health institutions during the 1960s, the sick and poor are now finding themselves within the purview of criminal justice institutions. It's actually three related but distinct theories at work in that argument about these institutions: the thesis of deinstitutionalization, something I call retrenchment criminalization, and the history of mass imprisonment. While the ideas form important backdrops to the explanation for the rise of medicine and jails and its restriction of public hospitals, it can't fully account for important countervailing trends. First, regarding deinstitutionalization, there's the problem of the administrator's willingness to provide healthcare resources in jail. That is, if the closure of mental health facilities explains the rise of mentally ill inmates in jail, this does not explain the tremendous rise of healthcare spending in jails. That is, the willingness of systems to pay the salaries of medical professionals, costs of accreditation, medication, et cetera, for healthcare in their jails. During the 1990s, medical staffing in our largest jails more than doubled. We must ask, why have jails not simply let inmates languish the way they used to during the 1980s and earlier periods? Second, while the retrenchment criminalization thesis might explain the decline of public medicine in public hospitals with the attempt of politicians since the 1970s to curb social expenditures through the application of market rationality to public institutions and the racialization of public spending, it doesn't quite account for a tremendous rise in the amount of money that we're actually spending on public healthcare. Healthcare spending actually increased during these years and we can think of it actually as a case of welfare state resiliency. On the right here, you can see this kind of rise in Medicaid funding, and this sort of persists despite rising healthcare prices and cost per poor person. Astonishingly, exactly during the period of public hospital capacity declines, mechanisms were created by the federal government to funnel public money into urban safety net hospitals, actually allotting for the extra care that they provide for uncompensated care. Aside from mandating that all ERs have to take people regardless of pay, under Ronald Reagan, the funding actually survived 2 attempts to turn it into a block grant. Finally, what can be described as the broad history of mass imprisonment. The idea here is that the criminal justice system has grown so large and is so now well-funded that we've increasingly become a site where the urban poor access social services. However, it may be surprising to hear that in our largest cities, the jail systems actually stopped expanding in the early 1990s. They've been suffering from retrenchment ever since. Jurisdictions have experimented with all manner of early release and alternative incarceration systems in order to make their budgets. Sort of depending on the budget year, you'll see that our major jails, most prominently LA, Chicago, and New York, oscillate 500 to 1,000 inmates every year, depending on available budget. The situation actually characterizes the other top 50, the major jails in the other top 50 MSAs in the United States, which represents about 30% of the nation's jail population. In total, while these 3 related but distinct theses create important backdrops to the problem, they can't fully account for important countervailing trends. In the book, I talk about the methods that I used, which was pairing deep ethnographic observation with this archival history of LA County, which has the largest system. And I did a kind of essentially a within case analysis of various crises in the system and sort of compared how they were resolved over time. And I'm happy to talk more about this. This is a picture my friend shot with a drone of the major jail in Twin Towers Jail in LA County with the public hospital on the far left there. And these are the kind of decision makers I study, the board of supervisors, and here they're grilling the sheriffs. The history I used and the fieldwork, and the history and fieldwork, I use it to formulate a new theory to explain this puzzle. I argue it's the confluence of fiscal austerity and legal demand that creates the conditions for the transformations in poverty governance institutions. As I show, state officials confronted ever-decreasing resources at the exact same time that new legal rules forced them to expand access, provide more services, and enforce rules that were severely neglected. We've already seen how budget retrenchment affected jail sizes, but the problem of austerity runs much deeper. No deliberation on poverty governance in the US can move forward without addressing the limits of city resources. Close to 300 municipalities are currently in default on their debt. Alongside limits of fiscal resources, what's lost in many analysis of poverty governance is what legal historians and political scientists call the judicialization of American politics. A large share, especially the kinds of local municipality questions, a large share of policy questions become judicial questions, answered not through political party representation, grassroots mobilization, or coalition building, but through litigation. So in the spaces that I study, the kind of force from below is refracted through a specific kind of institution, and that's the courts. What happens when officials are forced by legal imperative to expand programs during a budget shortfall? I developed the concept of redistributing the poor to illustrate how state agencies resolve this tension. The idea describes how state agencies circulate people between different institutional spaces in order to raise revenue and project the illusion that services have been rendered in legally adequate ways. And I detail how it occurs through 3 processes. First, state agencies work to reclassify the people they're in charge of. This means that public officials will re-articulate the kind of interventions that their wards are thought to require, for instance, emphasizing the mental health needs of a jail population, or that they're primarily made up of homeless persons, for instance, rather than their security risks. So a move from casting the population as violent gang members to sort of less violent mentally ill, Second, the reclassification allows the movement of such wards into different institutional spaces, or changing the kind of interventions that those spaces provide. By doing so, they can make claims on revenue from other state agencies that are both horizontally located, such as a mental health department providing services and revenue to a jail, and those vertically located, such as a jail pulling in from revenue from a state health tax or renting space to a state or federal agency. Third is key is that it's this continuous movement of individuals between old space and repurposed space that projects the illusion that service has been rendered in legally adequate ways. So it's not necessarily what goes on in these separate spaces that's important, but it's the mere transfer of people between those spaces that sends a legal signal of compliance. In total, these 3 processes align the officially recognized demand with precious revenue. In total, jails have moved to expand medicine not only because they're seeing more mentally ill arrestees, but because reorganizing their jails along these lines has allowed them to tap into new revenue sources and new means of abdicating responsibility for inmates. Likewise, public hospitals move to restrict access to medicine not simply due to cutbacks and criminalization, but because doing so allowed them to generate revenue from new sources and to rationalize extreme wait times. I didn't talk about that much today. The Redistributing the Poor is a product of distinct agencies acting alone, often in conflict with other state agencies over which one of them will have responsibility for different categories of people and the public revenue attached to them. There's a moments of statecraft in which poor people are legally and technically provided with the services, but their needs are rearticulated into a different, more affordable kind of need that produces revenue for the state or more conservative budgeting. So I'll leave it at that. Thank you very much.
All right, thank you so much, Armando. So I will kind of open it up and ask for Al and Aaron, who wants to start? Someone have a like a really big, Al, is that sure? Okay.
So we'll
just bounce back and forth and just kind of engage, and Aaron jump in and just, yeah, let's just see what happens. And if I have your list of questions as well. So if we need me to like remind or push something else out there, I'm here, but I'm just going to step back and let you all go and see what happens. Does that sound like a plan?
Sure, sounds good. So Armando, I really enjoyed the book, and this will be a kind of take on the argument. You know, let me know if I got it wrong. But you're basically, I think, telling a story about administrators in these facilities who are dealing with austerity, budget, tight budgets, budget reductions, and also ratcheting legal requirements. And as I understand it, basically you're telling a story about how these folks manage these two tensions by basically reclassifying, shuffling people around, recategorizing people so that they can be handled in different ways. And I really enjoyed, I enjoyed the book for many different reasons, but I like the idea that, one of the tools for administrators is basically recategorizing, redefining categories of people and reclassifying people, which is something in the public management literature I don't think we pay enough attention to, the way in which labels are attached to folks with consequences. I'd be interested in probing a bit more about what the objective function, what we imagine you're basically telling a story about administrative behavior. What's driving the decision-making of administrators in these facilities, I think. And I guess what I'm wondering is how would you describe the sort of objective function, what the set of goals of the administrators are? Based on the story I told earlier on, part of it would be they don't want to be punished for violating the law. That's one thing. And they want to maximize revenues or meet some kind of optimize their budget in some way. So that's like two things. But I'm wondering, are those the only two things that the administrators are worrying about when they're making these calculations? You mentioned some other factors in the book, reputation, legitimacy, and so on. But I was wondering if I could just ask you to sort of round out your picture of what you think is going on in the brains of the administrators.
Absolutely, it's a great question. It's something that I mulled over for many years. But the other possible kind of things that in the realm of things that an administrator might be worried about. We immediately think of sort of electoral politics, the ability to get reelected, public administrators fighting for their own jobs, thinking on the level of individuals. But actually, I want to go to how the goals and preferences of these actors actually get destabilized, and in these moments of crisis, and crisis isn't something I talk too much about today, but essentially these are moments of such ambiguity and such loss of well-structured situations that these actors don't actually know what they want. They don't know. So for instance, if it turns out the way to save my jail is to fill it up with state inmates, meaning I need to let out local county level inmates and fill them up with state inmates. And that's a way for me to make revenue. So during the crisis, I might think to myself, as an administrator, no, I don't want to do that. That's essentially giving up authority over my jail. That's a way of, that's a failed institution. I'm failing the local public here. I might not get reelected. And that's a preference at first. But as people work their way through ambiguity, and here I'm drawing on the work of von Ermakoff about contingency and how actors deal with uncertainty, but that their goals get reformulated there through kind of in their peer group networks, essentially, which is what the archival data is about. And they come to change their preferences as something that they couldn't have predicted before. So kind of rational action gets refracted through these moments, and they might come to see filling up their jail with all state inmates as a kind of in their best interest and as a version of institutional survival when they actually previously saw it as institutional failure. And so what I see is this kind of language game that, and colloquially, you might see this as a bureaucratic sleight of hand, but I actually think we could capture it with the right concepts, that a language applied to a problem that changes people's goals. And so it's that kind of that model of rational action amidst sort of severe uncertainty that I try to kind of hone in on the book. So that's where I take that question.
Could I just pick up quickly on that, Brian, if that's okay? So I would get out of that then kind of a trifecta, which is that because you mentioned, for example, the hypothetical administrator who's trying to save their jail. So what I would take out of that is, okay, these folks are motivated by a sense of mission. What is my function supposed to be? What's my mission supposed to be? Let's recognize that that's kind of a woolly term that could be interpreted in different ways. So they're motivated by mission. They're worried about legal constraints and legal liabilities, and then they're also worried about budget. Is that sort of the kind of simplified model?
Yeah, I definitely didn't want to write a book where it was sort of all public choice analysis, where it's just individuals motivated at keeping their station, and then I didn't want to write a book that was about individuals just concerned about sort of punishing people all the time. To me, what really motivated was this sense of like, I have to keep, this jail has existed before. It's a tradition, or this hospital, it's been here, and the goal is to like keep it alive under sort of any means necessary, even if it doesn't make sense for the new problems or the new situations we're encountering. It's sort of like, I got to keep this alive. And because if you talk to public administrators, and if you talk to, say, an administrator of university, they're quite committed to the organizational missions of their universities. And so I wanted to kind of bridge that kind of level of understanding of people who have that commitment to the institution with sort of what outsiders see as sort of problematic behavior. I wanted to kind of not separate those things.
Thanks. Over to you, Aaron.
Okay, yeah. First, I want to say I just think this work is great, Armando, in the sense that it gives us a look at how these sort of local players and local actors are interacting with sort of multiple things, with state institutions, as with sort of, I'm assuming also with federal policy and funding and all these sorts of things. And that's very similar to the work that I do in Flint and sort of explaining the water crisis there. But I'm interested in sort of how this meshes with regionalization. So you really talk about sort of contemporary urban governments sort of having to deal with these sort of catastrophic budget cuts and sort of being also held to this minimum sort of service requirement standard, right? And I'm wondering sort of two things, right? How has this sort of been affected by the emergence of regionalization and regional governments, right? So, for instance, in Flint, jails are county system. So the city never debates the funding of it, largely because they don't have control of it, right? It's this county sort of thing, right? And what we know about suburban municipalities is that although they are affected by austerity, they're affected in sort of different ways, right? So I'm wondering, right, are there sort of differing outcomes when these spaces are funded by sort of regional governance, right? And when it's not sort of the sole responsibility of a municipality to pay, right? Because what we also know about suburban communities is they're vested in different things, right? And so they may be far more interested and far less likely to let out people in the sort of, county jail, in the sense that they think if they don't have this sort of tough on crime mentality, it will spread to their communities, right? And so they may see funding and governance of jails and hospitals as well differently, right? And maybe you didn't look at that, but I'm very curious as to how like regional governance affects these institutions, and if you sort of looked at that.
Yeah, absolutely. I mean, so the first thing to say is I actually studied LA County, so it's a county government that serves multiple cities. The jail is kind of the different cities. Police departments send their arrestees to this jail, and the same goes for the public hospital. It's a county facility. And I think you're absolutely right to hone in on that dynamic. It's something I do not talk about in the book, of what it means to study the differences of studying a county as a local decision maker versus a city, which is often where we go to. And that's precisely because of these different constituencies. And so that's, I'll give you one example of where it might matter. So when I say the LA County Sheriff's Department was sort of hit with budget austerity, in part, it's because of other kinds of demands placed on their services and their budget that didn't include the jail. So a big one was suburban communities' demand for police patrols. So the sheriff contracts its services to different city municipalities within the county. Otherwise, they would just sort of police unincorporated areas. And so some cities, suburban cities, basically say it's too expensive for them to run their own police departments. We want to contract out. And the issue is sheriff departments sort of have limited employees. It's kind of, at this period, it's kind of actually kind of hard to get cops because they're not paying enough, and they're competing with sort of other levels of government for individuals that would qualify. And there's this battle between suburban communities sort of saying commit more funding to kind of patrol and then the jail is sort of under legal threat to sort of, if it doesn't expand or if it doesn't let out prisoners, it'll sort of be taken over by federal authorities or something like that. And it's that interplay between suburban communities and the politicians that represent the county, where those are their constituencies. Those are people invested in their re-election. So there's a whole dynamic there, a sort of wider concern. And to me, it was a language game. Again, I'm going to go back to that. The politicians have to convince players amongst their constituencies that keeping jails open is sort of in their tough on crime interest. I mean, so it's this reframing thing that goes on over the years. So there's absolutely that dynamic, and I could come up with similar analogies on the public hospital side, for sure. That's very interesting. So you studied Flint, the water crisis. You have studied, or you're studying the Flint crisis in Michigan, and you've seen similar dynamics there?
Yeah, I mean, I have studied it, and it's also, and I'm still actively studying as well. But it is a case of very affluent counties having great deals of control over resources, basically in the city of Detroit, right? And because they are so affluent and so powerful, their agendas are different, right? Like they don't have the constraints on, for instance, Oakland County doesn't have the constraints that Detroit or Wayne County has when thinking about jails, right? And so Oakland County has always established itself as this very tough on crime county to keep Detroiters from going to the county, right? So if you're always arresting people, if you're always writing tickets, if you're always prosecuting, and this is L. Brooks Patterson, who was the prosecutor there for a long time, and then also a county commissioner, built a career on very, very harsh sentences for very, very petty crimes, right? And so the nature of it is kind of different, be it how counties here are funded and how they're sort of structured. So I'm very interested in these sort of localized implications, right? Because I think we do a lot of sociology that looks at the federal government, that looks at these sort of policies, that says austerity is austerity, austerity a lot, but doesn't tell us how austerity works in our communities. Mm-hmm. And I think these local players and these state level actors have a lot of control in how they're reshaping these sort of things and how they're sort of taking over communities through regionalization and through sort of the process of gentrification that we're just ignoring on the left. Whereas like when the right loses, right? When the right lost the presidency to Obama, the first thing they did was go to the local, right? And they reshaped local politics, right? They redrew up the line, they redistrict, they redrew up the lines, they focused on local policy to get their sort of agenda. And I feel like, you know, a lot of the work on the left is just like austerity, but it doesn't tell us or help sort of activists think about like, how is this happening in your community, right? And how you can sort of fight back against that, right? And I think this is great in the sense that you deal with one, the sort of public consciousness thing, but also you deal with how we're redistributing problems, but never solving them, right? And how, you know, these things so quickly leave the public consciousness, right? And I thought it was so great that you brought up, like, this is the third president where we have this issue of children at the border that has not been solved. Although like the public consciousness of that has totally disappeared, right? Or for the most part, right? This was a huge thing under Trump, heard it a little bit under Obama, but now we're not even talking about it, right? And so I think it's brilliant. I don't want to spend too much time, but I think this is great in the sense that you're looking at how these things impact communities and the ways in which these actors are negotiating those things.
Absolutely. This point about, I mean, I at the sake of reiterating it, I think it's incredibly important. What's funny is a lot of our classic books on city governance are at that local level, but you know, this specific point that sort of where the magic happens, where where state decision making really matters is at the local level. I mean, that point needs to be reiterated. I absolutely agree. I mean, the actors that I'm studying they're intervening in federal politics. I mean, it's like policy from below, like local politics shaped federal policy. I mean, it's not like a one-way street where we typically think about it. You know, these county level supervisors are in the White House telling them how to fund public hospitals. I mean, they shaped what the Clinton administration did in the 90s, the LA County supervisors. So there's a lot of action there.
So I'm going to bring a question from Professor Jane Fountain in because it connects something that you were discussing with Al and with Aaron here. And it relates to both what people were, what the administrators were thinking and deciding to do, and that relates to preferences. And that I think that might be interesting to connect that with what Aaron was talking about in relation to the suburbs in different areas. So I'll just read the question and then throw it out there. So, to what extent, Armando and others, does it make sense to say that agency decision makers are interested in survival and the appearance of professional legitimacy, but they don't have preferences beyond that? By contrast, their preferences are discovered or constructed as they maneuver through their constraint space amid ever-changing resource environments. That is, they never solve problems, right? They massage them or perform administration and treatment. So I just want to put that out there as in relation to what you were just saying, and see if you wanted to respond.
Tell me, I agree. That's what I said. Tell me I mean, what's the question at the end of there?
So I guess it's more of a sort of, I think if I, actually, Jane, how about you unmute and you can flesh it out a little bit?
Sure. First of all, I haven't read the book, but thank you for writing it, and I'm looking forward to reading it. I guess the nub of the question for me is, to what extent do you think that even talking about what these agency heads, if they're the primary actors, in terms of preferences and goals, even makes sense? When means and ends are, it's decision making under ambiguity, to use like ancient organization theory. You're not quite sure what's going to work. The environment's changing rapidly. Maybe you have stability over the course of a year in your budget because you have annual budget cycles, but you have different cycles, electoral cycles, budget cycles, etc. You have multiple partners with different preferences, and about the best you can do is just sort of survive. And if you're gunning for higher level positions, or well, basically, if you're gunning for a higher level position, you do what you can to make your numbers look good so that they tell a story of success.
Yeah, I mean, in the book, you'll see it. Most of the writing is about that goal reformulation. It's less about sort of, as you say, the kind of underlying preferences of actors, or their kind of, are they acting rationally or not? And so another way so I keep bringing it back to empirical examples. So nothing about what these administrators and politicians did you could have predicted. I don't think you could have predicted just knowing their political party representation, for instance, or knowing their sort of history within an agency, and sort of, if they were sort of more progressive leaning or more conservative leaning. What was more progressive leaning or what was more conservative leaning was something that was invented during these crises. It kept getting reformulated. So like, for instance, if I told you politicians they decided that they were going to reduce the size of a public hospital in half in 1 year, reduce it from 1,200 beds to 600 beds, you might immediately think of that as a kind of regressive sort of fiscal hawk sort of saying that. But it's actually progressive leaders that come to see it as a progressive goal, in that they need to build more community health clinics. They can shift money around. People need to be in outpatient. They don't need to be in the public hospital, et cetera. So it's kind of reframing what it is people want. And so, I mean, if we want to go back to what we think is motivating people, to me, like, we can think of rational action as a kind of one mode of action. Sort of it's optimizing behavior. But people they're not always in that mode, but they tend to get in that mode during crisis. Sort of crisis forces them to coordinate, to optimize. And sort of but that leaves them really open to reshaping their preferences if we can think about it as a mode of action. So that's how I kind of saw the larger story going on.
Armando, if I could follow up, what constitutes a crisis? Is the crisis based on human suffering, or is the crisis based on some political conflict that's going to blow up if they can't come up with a reformulation of a situation, or a defense of their so-called strategy to do better for the public?
I love this question. I love thinking about this one because it's really hard to tell. I mean, some would say that if you looked at the same data I did, every year seemed like a crisis. Every budget, it's just like setting the budget was a mini crisis. And it's hard to disentangle that from like the longer term crisis. So like the public hospital system in LA County had a structural deficit of $500 million every year for about 20 years. And it could only fill that gap with federal funding every few years. They had to keep qualifying for this federal funding. But I think there's something a little more interactional going on. there's a feeling of crisis. There's emotional salience amongst actors. There's a feeling of okay, let's convene some meetings to rethink rules. Are these rules working for us? You know, sort of expressions of shock, fear, dismay. I think we can kind of get at, that's another way we can get at a serious crisis. You know, because those tend to coincide with major threats. So 1 year of losing $60 million in the budget is different than the threat of, or sort of the CEO, the top bureaucrat in the county telling the sheriff they have to close 8 of 9 jails in 1993, you know, sort of, you're going to have to let inmates out, and you're not going to get reelected because of that. Like that's pretty clearly that's a different level of kick in the butt there.
All right, we have 2 more questions that we're going to go to, and the next one is by Brendan Beck. I will read it, and if we require further unpacking, I will let Brendan do that. So I'll start by just reading it. Dr. Lara-Millán, thanks so much for your great book. Am I right that you're arguing against the theory that welfare retrenchment begat mass incarceration? If so, are you then arguing that the number of people who were incarcerated and hospitalized has stayed stable since the 1970s, but merely cycled through different institutions?
Yeah, great question. I love this. I do have to, it's important because when one makes an argument like mine, this is one of the situations where nuance is really important. And so I love answering a question like this, but essentially, so during this period, when I say that after the 1990s, specifically large urban jails stopped expanding and they sort of were oscillating through budget cycles, that doesn't preclude the fact that sort of police and sheriff's budgets were still going up. The cost of incarceration was just getting too high, and that mainly had to do with medical costs. And so claims that sort of police budgets are overfunded are correct. They are. We have a problem of over-incarceration. It also doesn't preclude the fact that the sort of net widening is going on. So when people are being released from jail, it's cheaper for authorities, but that doesn't mean they're not suffering the moral indignity of parole and probation. Which is something else that scholars are talking about. It's also the case, if you think about this welfare retrenchment, the closure of deinstitutionalization during the 1960s. So a few works I'll reference on this. So first of all, it is true that formed the backdrop of what happened. So people were sicker. People being arrested now are sicker than they used to be. But that, and it's important to note, we've also changed laws since the 60s. They've got more punitive for the types of behavior that sick people tend to engage in. So where before it might be a citation for public urination, now you might spend time in jail for that in a major city, for instance. But so the laws have changed. But so that is to say, that story of the closure of mental health facilities forms the backdrop of what I'm saying, of the story here. What I try to explain is the increase in spending on healthcare in jails, which requires a different kind of explanation. It still required that the population was sicker than it used to be. If that makes sense, that nuance, I hope, makes sense.
Yeah, so if I could just ask a follow-up question, and thanks, I've got your book here. I can't wait to dig in even deeper. So it sounds like it's a county level explanation, but maybe at the city, at the municipal police level, there might be something else going on. And then well, let me ask you, is there maybe something else going on at the municipal level? And then also at the state level, because I think the state incarceration rates probably, kept increasing until about 2008, 2010. So is this a pretty county specific story you're telling?
Great question. So I do think this crisis of law and fiscal austerity started bubbling basically in the early 90s, and as you say, started reaching state levels during the Great Recession in 2008, 2009. And then we finally saw the incarceration rate dip for the first time in 4 decades. It was basically 2009. There's another story where most of that dip had happened to do with California. So there's still the outstanding question. This is a California story. So that might be something people want to talk about. But yeah, so there is this kind of county level story that it's a crisis that's moving from the state. And I'm currently writing a paper now about prison realignment in California, where this kind of fiscal austerity law sort of hits the state prison system, and it pushes a ton of inmates into the counties, and they have to deal with this. At the municipal level, I mean, some other recent books that have come out that I think are really interesting on this front. Josh Symes' book about ambulance drivers. If you read that book, you can see a lot of the same, the kind of basically trying to explain the fact that ambulances are more prevalent in poor neighborhoods. And we tend to think that ambulance services are, and we tend to think the actual reverse. And he has to explain that essentially with kind of legal imperative and with the efforts of the private company to make money. And so there's this same story of tension, of trying to resolve this tension that explains a lot. I think it explains a lot of what's going on. I know Forrest Stewart's book on policing in LA, I think is another way to kind of look at this on I guess not so much city level, but frontline level, even more frontline level than this. And there's a few others that come to mind.
All right.
Thanks so much.
Yeah, thank you for the question, Brendan. We're going to jump to Jasper's question because it's kind of related to this. And then we're going to ask a sort of hybrid question that Aaron and Al both kind of put I'm going to combine 2 of their questions into one. And then we're going to go to Josh's question. I don't know if we'll have a lot of time after that, but send your questions in and we might be able to, depends on how fast we answer these and whether my hybrid question is stupid or not. Maybe they were better off left alone, but we're going to try. But first, Jasper's question, which is definitely a great one. Thank you so much for your presentation, your powerful theses, and the intriguing book. This is a historical question. To what extent would you say do the developments you discussed and explained stand in the tradition of even longer historical phenomena, such as the use of asylums or the criminalization of poverty in the 19th century? Is there a long durée story of redistributing the poor?
You know, I've wondered about this. If you actually, I think somebody could study this. So if you actually look at some of the more detailed studies of the rise of mass imprisonment during the 80s at the state and federal levels, mainly the state levels. I'm thinking of Heather Schoenfeld's book about Florida, the rise of Florida state prisons. Michael Campbell's book of prisons in Texas. You know, it's not something that's centered to the analysis, but early release was a major tool that politicians used to kind of make budget to deal with legal sanctions of jails that really did spring in the 1970s. There was a lot of sanctioning of prisons at that time. And that's not to say they weren't growing. They were still growing. It's just they couldn't keep up with the inputs. And so I do wonder. I was told that during the 1970s, there was a huge redistribution between the state of California prison system and its parole system. So I do wonder about ebbs and flows of redistribution and how sort of, if there's a larger story going on. I mean, I studied 1990 to the present. So I think there might be something to that.
Wonderful. Thank you, Jasper, for the question as well. So here's the hybrid question, and then we're going to jump to your question, Josh. You're still. I just want to make sure you're still there. There you are. Thumbs up. All right. So the hybrid question to sort of, and Aaron and Al, feel free to reassemble this into something more appropriate if it's going in different directions. But this is both a methods question and a resistance question. Okay, in one. So Al is interested in how might this be applicable in the realm of policy analysis. Aaron talks about thinking about the disappearing works to evade scrutiny and wondering about strategies of resistance. And what I would be curious about, Armando, if I could ask, if this question became one big thing, is how did you contemplate and work through taking the unseen or the disappeared and turning it into something that's visible, right? In the way the book is. And able to be seen and understood. And if you might think about that methodologically speaking, how you were able to capture that story, are there ways you can think of that being used not just by someone in academia, but also by, say, community activists that are facing some of these things on the local level as well? That is, how might some of these methods that might be useful in policy analysis in general to see the disappeared might also be useful as a resistance mechanism as well? And how might your thoughts on that as you figured it all out play out? Is that okay? Is that?
Yeah, that's a great question. I want to write this piece, but I'm struggling to do it. But so if anybody wants to jump in with me, that'd be great. But I do think there's a way to make some of these concepts in the book useful for social movements as they engage the state. And so where my mind goes is so we like to say history matters. History makes it sound like this old tired thing. I mean, I really just think it's like the passage of time matters, and social movements can remind politicians of what has been, and they can make that, I think, legally actionable. So I'll just give you one recent example. So here in Oakland, in Alameda, during the pandemic, a lot of local ACLUs the local ACLU made an effort to pressure the sheriff to release inmates during the pandemic because there was the threat of the virus in jails. It was sort of rapidly decreasing. Little known fact, but jails actually responded. They stopped booking people into jails. I mean, they didn't at the state level, but they did. So in LA County, for instance, they dropped the jail by 7,000 people in 1 month in the spring of 2020. And so had I been arrested in Oakland, where I live, in the spring of 2020, I wouldn't have spent any time in jail. But had I been arrested, if I'm arrested now in the spring of 2021, I would spend time in jail. And I would suffer the consequences of that 48-hour stay, which we know through the work of Sandra Smith, there's lifelong consequences there for just spending 48 hours in jail. And that's something that has nothing to do with me in my case. That has something to do with administrative decision-making. And if we can look at that, what the reality of someone who would not have spent time in jail, but that reality is what gets disappeared. It's that suffering it's that moment of suffering that gets disappeared. And I do think as people trying to change these institutions, sort of capturing that contradiction, that contradiction where administrators rely on assumptions about a population. So in this case, it's okay to have sick people in jail, or it's okay that they get sick while in jail, that they later rethink that during a crisis, is something that we can point out and perhaps make retroactive. Sort of, you need to compensate for people for, you need to bring people that spend time in jail, bring them up to speed on your new policy of releasing people. So that's just a simple way of talking about how we might be able to describe these changes in preferences, to reference our discussion earlier. So that's where my mind goes to when I think about that.
Brian, could I do a quick follow-up?
Of course.
Armando, you're telling a story about the way in which certain populations, call them vulnerable populations, get maltreated as administrators try to deal with crises. I'm wondering, how extensible is the story? Could Could it be applied to other institutions that aren't dealing with, vulnerable or weak populations? For example, if you look around your university, could you see administrators there behaving in similar ways with similar effects?
Yeah, I do think so. I mean, the university is one. I mean, I don't want to speak out of pocket. I mean, I know I don't. I mean, I'm not up there with it, but
in
just
a hypothetical university.
Yeah, there was a West Coast university, a major West Coast public university that, during the recession had a trouble meeting its budget and began admitting more out-of-state students, which carry a higher price. So that's, to me, that's shifting the characteristics of the clientele. I mean, I'm not saying that's good or bad, but that's what happened. Then the legislature passed, years later, passed a law saying that they couldn't do that anymore. That a certain percentage of students needed to be in-state. That created a legal quagmire that brought back a budget problem from the Great Recession years later. And so I think they've had to be innovative. They've had to rethink what their preferences are. They have had to rethink what's the point of the university. Is it serving California, et cetera. I say I don't want to speak out of pocket because I don't know the details of that story. I mean, it's possible I got all that wrong, but I do think, I think it's possible. Yeah, I suspect it is.
All right. Aaron, did you have any follow-ups on that, or do you, I don't want to force you, but I just wanted to.
Okay. No, I thought it was good, so no.
All right. I'll jump to your question, Josh. I really appreciate this conversation about administrators' decision-making, but I'm also curious how these frames and modes of actions did or didn't filter down to the frontline actors, nurses, guards, doctors, etc. My sense of the book is that those actors too were dealing with daily crises of budget and capacity. So I wonder if you can talk about how those everyday interactions seem to track or not the logistics of scheduled meetings and decision-making.
Absolutely. I love this. I mean, in the kind of implementation goes awry literature, we tend to think of these sort of the ideas going from top down to bottom. Sort of the frontline actors are kind of using their discretion and it just goes awry. I think if we study these moments of crisis, we can actually see the meaning making that gets created on the shop floor. So here, I think I referenced Josh Times' book about ambulance drivers earlier. So the interactions between police, firefighters, and ambulance drivers about where they're going to send certain types of people they encounter on the street, where they're going to send them to jail, they're going to send them to hospitals, throw in the medical examiner too. That routine problem solving, so they're encountering routine problems and they're developing a culture of how to deal with those routine problems. That meaning making that goes on there, I actually think influences politicians. And here's what I mean. When politicians are in that kind of goal ambiguity space, looking for answers, trying to figure out the situation at hand, when it's not clear, they're in that kind of uncertainty space. Where do they get answers? They invite frontline managers to come sit in on meetings to tell them different ways of thinking about the problem. And they actually get ideas from below. I mean, frontline actors. So I do think there's actually a kind of thing there, and that sets policy in stone. So then you get a jail built, so the administrator tells them we're dealing with all these suicidal inmates and all these problems. And so they build a jail with a medical wing attached to it. And that institutionalizes an understanding of the problem so that future frontline workers are already in that process. They're no longer needing to develop routine culture. That culture is a part of the institution at that point. And so I think we need to study these feedbacks, but between crisis and stability.
All right. Are there any other questions?
Thank you, everyone. I appreciate it. This has been one of the best discussions I've had.
I don't necessarily have another question, but what you were just speaking to, Armando, seems very much very similar to how Cedric Robinson explains racial capitalism, in the sense that the sort of social institution, or the social institution of capitalism, is built in these sort of ethnic conflicts in Europe, right, that are then sort of brought to this national and sort of global level and spread, right? So they get this idea about colonization through this sort of ethnic conflict and exploitation, right? Just feels very similar to me, in the sense that these local actors do have a lot of power in shaping institutions, and they're also being shaped by sort of national policy and state policy and the constraints of that as well. But I think too much we think about it as it's just top down, right? It's just that the federal government says this is what we can do, and you know, in my own work, I've seen that like the rules are constantly bent and broken too, broken in ways, and most of the time, no one checks it. It's just like, nah, you know, people think they can't do it, and then it happens, right? And so, yeah, I mean, this is all incredibly interesting to me. So yeah, I thought it was great.
Thank you. You know, absolutely, Aaron. That.
Well, Armando, right before you respond, I want Al to wants to say something else, and I want to give you the last word.
I wanted to
ask a question also, Brian, if there's time.
All right, let's keep it going. I'm not gonna send it away. So, all right, Al, you're like, so we'll do Al, then you'll talk to them, and then Sancha, you're up. Does that work?
Right.
Sure. I just wanted to make an observation. So one of the neat things about the book, Armando, is that you're doing observation.
Yeah, those I like.
And you're also
need one.
You're doing. Pardon me. So you're basically doing observation, but you're also doing archival research, which is kind of a funky thing. I'm kind of curious to know whether you became, when you were doing your observation in the facilities, kind of like the expert because you had done the archival work too, in the sense of like, were you telling folks in the places where you're doing your observation what the history was in some cases?
Wow, I've never been asked that. No. You know, I teach my I teach my students in participant observation. I mean, what you do is you play naive. I mean, that's the skill. You play dumb.
Oh, yeah, okay.
You just constantly ask people to explain things, whether you know it or not, because in their explaining it, they tell you why they're doing something. So that's usually a strategy there. But yeah, there was a time when nurses are complaining about drug-seeking patients. You know, it's like, okay, well, I know that in 2001, JCO changed its rules that mandated waiting patients be given heavy pain medications. You know, sort of like, I knew where that came from. So it's not, you know, it's not something I share, no.
Okay, thanks.
So could you want to respond to Aaron, Armando?
Yeah, I mean, it was just going to be my closing thought, but you know, what really, if I think on a personal level, what really irks me about all this stuff is what Aaron said. So a lot of people some people, not always, I actually think it's far less than we think, have broken rules in their lives and are in prison or didn't get the care they needed, the health care they needed in hospitals. And administrators think, you know, sort of, it's okay for them to break rules in emergency situations. And I think people in their daily lives are living emergency situations. And that kind of contradiction, that irony, just pissed me off. So that's why I wrote a book about it. So I'll just say that. You know.
Thank you. Sancha, you had a question?
Yes, I'm so sorry. I missed the first part of your presentation, but I was able to, from the conversation, I was able to glean some of what you said before. It's very interesting, and thank you so much for writing this book. So I know a lot of what you've said is like, you know, you have the crisis, and in this moment, people are trying to figure out what to do, right? So that decision making is sort of like the crisis prompts this decision making. But I'm thinking also about I'm thinking about disasters. I study disasters and crisis situations as well. And drawing on Naomi Klein's shock doctrine And certainly what I've seen in the field in terms of, where people, for example, let's think of public housing, where you've had these ongoing court battles for a while, trying to get people evicted, or removed, right? So that developers can utilize these spaces for other opportunities. But these things have already been ongoing. And then the crisis or the disaster happens, and then that playbook is already there. And then they institute it in that moment, right? And I know Naomi Klein makes the same argument looking at crises like wars, Iraq, and Colombia, and lots of other places where she talks about Milton Friedman having that playbook, and the Chicago School having that playbook of, when this happens, this is what we do, right? So do you see were there any elements of that where you may have seen, there were people thinking about certain strategies before, and then this moment came about, and then they're like, aha, let's do this?
That's really interesting. I've never thought about that before. So that really makes me think a comparison might be useful here, because then what explains situations like mine where it's really an emergent situation. There hasn't been litigation around a problem previously. A crisis hits, litigation happens, and litigation causes the crisis. And so people are a little more freed up to come up with kind of emergent innovations around it. Whereas you're talking about a situation where there's some more path dependency, I gather. There's been ongoing litigation that's it's constraining what people can do in that moment of crisis. So I mean, that would be fascinating to look. Could
be ideological too.
Okay.
Right? In the Naomi Klein situation, it's like more ideological. Like this is, how certain, this is the way that we should pursue, development in these areas, or capitalistic interests in these areas.
Yeah, that's great. I'm going to have to look at that. I do think maybe there's an empirical puzzle there that could be looked at. Situations where there is that kind of history, and those that there's less of it. Very, very good. Thank you.
Thank you.
All right. So if anyone that hasn't asked a question, Sophia, Swati, I guess that's all that's left. People seem to be heading out. But if that seems like that's going to be it, then I'll just say thanks for attending, and thanks for participating, and for the wonderful questions from people in the audience, and for just a good panel. So thanks again.
Thank you, everyone. I appreciate your time and energy on this. I really enjoyed it. Thank you.
Thank you.
Take care.